There are three muscles in the deep posterior compartment of the leg that are called the Tom, Dick, and Harry muscles, and they are named for their relationship to the medial malleolus of the tibia here. Their tendons cross posteriorly and inferiorly to the medial malleolus in the order of T for Tom, of tibialis posterior, D for Dick, of flexor digitorum longus, and H for Harry, of flexor hallucis longus. Even though these muscles are deep, they are somewhat superficial in this area of the medial distal leg. So if we find the tibia here, and we drop just off it posteriorly here, we should be able to feel the flexor digitorum longus. We ask the client to flex toes 2, 3, 4, and 5 without flexing the big toe, and when the client does this, we feel for the contraction of the flexor digitorum longus in the distal medial leg. Each time the client flexes toes 2 through 5, we can feel the flexor digitorum longus belly contract here. Now to palpate the flexor hallucis longus, we ask the client to flex the big toe without flexing the other toes. We palpate a little more distally than for the flexor digitorum longus, and now each time the client flexes the big toe, we can strum perpendicularly across the distal belly of flexor hallucis longus. To palpate tibialis posterior, we ask the client to invert his foot, and we can see its distal tendon directly next to the medial malleolus here, running to the navicular tuberosity here, as well as other parts of the distal tendon that travel further to attach deep in the plantar foot. Posterior to the distal tendon of tibialis posterior here, we may even be able to see and palpate the distal tendon of flexor digitorum longus.